Good afternoon, everyone. It's so nice to be with you today. And even though you hear me say even though you hear me say repeatedly with every person I interview how happy I am to interview them, this time, this is a much anticipated, eagerly awaited interview with the author of a book that I found several months ago. And I am just so very grateful for this resource and for Lily Nichols, who specializes in gestational diabetes as a registered dietitian. And I am going to let her tell more about herself and her credentials in a moment. And here we are. Here is her book. And actually, before we get rolling, I will show you my copy of the book so that you can see just how much I appreciate this book, because it has traveled with me a lot of places. It is an absolutely wonderful book. And oh man, Lily, I am just so excited to speak with you and to hear your thoughts on many things that are very, very critically important. And might I say, not just to those women who are pregnant right now, those women who are at risk of or experiencing gestational diabetes, but this message is actually important for all of us. But with that, I'd like to introduce Lily Nichols. And Lily, welcome. I'd love for you to share just a little bit of what brought you to where you are now and your experience and your knowledge and your interest in particular gestational diabetes.
Yeah, sure thing. Again, thanks for having me on. Yeah, my interest in nutrition has kind of been lifelong. We were chatting before we hit record that I was fortunate enough to come across the work of Dr. Weston Price and Sally Fallon over 20 years ago, before I even went to college and got my degree. So when I was in my, I did a conventional dietetics program, and when I was in university, I really spent a lot of time, you have access to all the medical journals. So I spent a lot of time kind of looking up, okay, do we actually have research about this thing called vitamin K2, or do we actually have research on, retinol and how it's a different form than beta carotene? And what about phytic acid and soaking and sprouting and fermenting grains? And, all of those things I kind of, I kind of pushed the envelope a little bit during my undergrad to make sure that, I'm not just getting the government propaganda dietary advice.
Yeah. And
so so I did quite a bit of smile and nodding, because I thankfully had already done some self-experimentation in diet. I had tried out vegetarianism and crashed and burned, and had felt for myself the benefit of increasing animal fat, and eventually finding out, wow, I might be eating too many carbohydrates because I'm having reactive hypoglycemia. I need a lot more protein than I thought I did before. I mean, it was good to kind of have that introduction into ancestral eating early on. Once I was practicing as a dietitian, I had the opportunity to work with the California Diabetes and Pregnancy Program, and also in clinical practice in perinatology, with primarily a practice focusing on gestational diabetes. And so in those roles, it became clear to me that the guidelines for treating and managing gestational diabetes were not quite as evidence-based as I had hoped, and they also did not perform well in practice. So as a good little dietitian, at the beginning, I tried to follow the guidelines, their recommended, minimum amount of carbohydrates and all of that, although I never pushed low fat on anybody. But I did follow the recommended carb guidelines, because the information that they gave you to the contrary seemed rather dire. And before I had really dug into the literature on it, it was like, well, this is probably the safer way to go. And my experience with clients is often it would not improve their blood sugar levels, and sometimes it would make their blood sugar levels worse. As someone who is not diabetic, had already benefited from reducing my carbohydrate intake and leaning more heavily on higher protein, higher fat, less refined carbs, this made sense to me. But it did take a lot of digging in the literature to make sure I felt that this was actually a safe choice for pregnancy. So We did eventually implement lower carb, better quality carb, higher protein recommendations in practice, and saw dramatic benefits in our clientele. So huge reduction in the common comorbidities with gestational diabetes, like preeclampsia, baby growing larger than average, polyhydramnios, difficulties at delivery, neonatal hypoglycemia, like the rate of all those things just plummeted. We also had much fewer of our clients requiring medication or insulin. So anyways, that's what led to me writing Real Food for Gestational Diabetes, my first book of 3 that I currently have out.
That's really interesting. I'm sure you're familiar too with the work of Dr. Diane Schwartzbein, who wrote the Schwartzbein Principle.
I am not.
Oh, you'll want to read that. It's one of my favorite books. I read it years ago. She's an endocrinologist who early in her career, I believe straight out of internship, went to work for the Mayo Clinic and quickly realized that the guidelines for the diabetics within their clinics were actually causing or increasing the intensity of the type 2 diabetes symptoms, and that they were actually, those guidelines were actually not only making people sicker, but, well, just that in and of itself was an important revelation to her. The guidelines don't work. They actually do the opposite. And what you're telling us, I think, is that you're recognizing that the same is true with recommendations for a diet for a pregnant woman. And in particular, I have a friend who has a number of children, and one of her children experienced that. She was a very large baby. I think she was almost 12 pounds when she was born. Her mom is tiny. She had a home birth, and thankfully, with a skilled midwife, she was able to birth the baby safely, but it was intense. The next time around, she followed the advice. I had shared with her some information, and another midwife had given her more. And it was exactly what you're talking about, a lower carb, and that we need more protein and more fat than what we're being told. So the next baby that my friend had was born at a perfectly normal size and with no difficulties whatsoever. This is what you're seeing as well in the women that you're working with.
Absolutely. Yeah. Dramatic reduction in macrosomia. In fact, at the hospital that most of our patients at this clinic delivered at, this was in Los Angeles, they would contact us because they're like, you had down in the chart that this patient was gestational diabetic, and this is not an infant of a diabetic mother, because the babies were all perfectly healthy. They weren't having big babies, and they weren't having as many birth complications. They weren't seeing neonatal hypoglycemia. So yeah, it was a dramatic shift.
Yeah, and that is amazing to me. So obviously you are seeing problems with the common dietary principles. Can you take a moment, step back, and just explain what exactly is gestational diabetes?
It is elevated blood sugar that either first develops during pregnancy or is first recognized during pregnancy, which are slightly different things, right? One assumes that this is something that's developing as a consequence of the changes in pregnancy physiology. And the other one kind of points to the fact that it could be an underlying blood sugar issue that we are simply catching during pregnancy, but there could have been a preconception, issue with blood sugar that had not been identified ahead of time. So there could have been insulin resistance pre-pregnancy. And I mean, as a whole, our population, there's like a 50% rate of diabetes type 2 and prediabetes, and most of those cases are undiagnosed. So a lot of times we're actually catching prediabetes in pregnancy. We're calling it gestational diabetes because this is when it was identified, but there likely was an issue going on preconception.
That makes a lot of sense to me, a great deal of sense. What are some of the possible consequences of not managing or mismanagement of this issue during pregnancy?
Yeah, that's a great way to frame the question, because I think a lot of people, There's a lot of fear mongering out there on gestational diabetes. If you have this diagnosis, you're guaranteed to have like all these adverse outcomes, and it's really quite scary. But really the risk of adverse outcomes is a reflection of maternal blood sugar levels. So how well and how frequently your blood sugar was in a good range or higher than average influences the propensity for one of these adverse outcomes. So certainly we're thinking about baby's growth. Maternal blood sugar levels are exactly what the baby is exposed to as well. The placenta does not block the transfer of glucose. So when blood sugar levels are high for the baby, especially when this happens over time consistently, the baby's pancreas actually develops differently. So it grows larger, produces more insulin. That baby becomes insulin resistant. They accrue more fat, so they grow larger than average. Not necessarily because they're exuberantly healthy, but because they're actually putting on a high percent of body fat. And then this can be a challenge, post-delivery, because these babies are, really accustomed to a high supply of sugar, and they have high insulin levels. Once they're born and you cut the cord, that sugar supply disappears, but their insulin levels are high. And so they can go hypoglycemic. Their blood sugar can drop too low, which can be dangerous. It's treatable, but it can be dangerous, often necessitates some interventions there. High blood sugar can affect the baby's lung development as well. So sometimes they have more challenges breathing. And then my biggest concern really is thinking about that child's long-term health. We know that babies born to mothers with suboptimal blood sugar control, their risk of type 2 diabetes is anywhere from a 6 to 19-fold higher risk. So there is some that those changes in the pancreas and their metabolism, that sticks with them for life. It's called fetal programming, or if you think of it in a general sense, epigenetics, right? Their metabolism's programmed in utero to some degree. Because it's like, why are we seeing this super high rate of childhood obesity and type 2 diabetes being diagnosed in 2-year-olds? Like, it's not just that they're not moving enough and they're eating poorly. There is a predisposition for it. And so we can interrupt that, generational transmission of poor metabolic health by helping maternal blood sugar levels. So that's the focus on the kids. There are, of course, other adverse outcomes that can happen during pregnancy. There's a higher rate of other complications that can occur for mom. Of course, if baby's larger than average, sometimes that can make, delivery a little more difficult. It totally depends on the case. Certainly, there tends to be a propensity for more, birth interventions, whether that's warranted or not. There's also a higher rate of other complications like preeclampsia, polyhydramnios, where you have too much amniotic fluid. So it certainly is something where if we can keep blood sugar levels in a healthy range, the majority of the time, we're better off.
Okay. And some of this information is new to me, some not. I had read about the increased probability of developing type 2 diabetes in a child who is born to a mother with gestational diabetes. And it's astounding to me. Up to 19-fold will have metabolic syndrome or insulin resistance. You alluded also, or you more than alluded to the fact that it's not genetics. It's not, people want to blame many things, including diabetes, on genetics because, well, mom was a type 2 diabetic or a type 1 or or grandma. But we don't see the diabetic problem going back multiple generations. Generally, it seems to be a more common, especially in the last 50 to 70 years. But I've seen it in the last 25, 40 years to just increase. And you mentioned epigenetics. You're talking about, and this is so interesting to me, how what mother does with her body and with her diet pre-programs to some degree the child. And whether we want to say that that's a genetic manipulation according to what the mother is doing, or we can label it as epigenetics, which I think is highly appropriate. It's important to understand that genetics are not set in stone. Am I correct?
They have some role, but the epigenetics refers to like how genes are expressed. So you may have a gene, like a genetic predisposition in your family line for a certain health outcome at some point in your life. Whether or not that gene is like turned on or turned up or turned down or turned off depends on, to some degree, on exposures during pregnancy. So maternal blood sugar levels are one of many possible things that can be involved in whether genes are turned on or turned off. Toxin exposure, sleep habits, circadian rhythm, smoking, you know, those sorts of things. Also, all of that stuff can come into play, and paternal health as well. So yeah.
That is fascinating to me. The whole field of epigenetics is fascinating, but it can be trauma related as well. So it's not that genes are influenced by the background of the mother, the grandmother, and all of that, which is epigenetics. But that's an influence. So what we do with our bodies preconception can have an influence then on our offspring. And in my case, once I recognized some of this, I realized that it was really important to do the very best I could do for my future children or whomever I happened to be carrying at that moment in time. It became very, very prominent in my mind, especially as I learned the research of Dr. Price, as you talked about, that we need to give children preconception and definitely in utero the very best diet possible. But let's take a look at standard dietary recommendations for gestational diabetes. It is appalling to me, and as I know it is to you. I found a couple of graphs or infographics that demonstrate what the standard recommendations are. And Lily, when I look at these, I'm thinking, wait, where's the red meat with the zinc? Where's the organ meat? Where's the fat that carries the fat soluble activators to metabolize proteins, for instance? When I look at these, all I see are carbs, primarily carbs. And most of the infographics that I found, many had fish like salmon, but most had vegetables and fruits and grains, vegetables, fruits, grains, and a little bit of other things. And this is absolutely appalling to me, and I think to you as well. So let's talk about the problems with the recommended dietary recommendations, suggestions. It's more than that. These are pretty much forced on women.
Well, you know, our dietary guidelines as a whole countrywide are based on shoddy data from Ansel Keys with his diet heart hypothesis. So everything is based upon this house of cards that we need to limit saturated fat and cholesterol by any means possible. And the pregnancy guidelines and the gestational diabetes guidelines are just an offshoot of that. So, you know, they're still recommending the same proportion of your diet come from carbohydrates as the general population. Their answer is kind of like I guess the one thing they may get right is that they want you to like spread your carbohydrate load consistently across the day, so you're not having like all your carbs in one meal and having an unexpected spike. But beyond that, they're very high carb. They're often not high enough in protein, and by being high carb, they're by default low fat. And so, you know, in typical like diabetes educator mode way of teaching about nutrition, you talk about, you know, getting this many portions of carbohydrates or this many portions of protein and like this very limited amount of fat, right? And the amount of carbohydrates that they recommend is just way too much. So like, think about it. Okay, we have someone who's been diagnosed with gestational diabetes. This is done via a glucose tolerance test. Let's see how your body can handle this amount of glucose. Let's see where your blood sugar's at. Okay, your blood sugar is high. Then they give you a meal plan that has almost the same amount of carbohydrates as the glucose tolerance test at every meal. You know, like it doesn't make sense. from like 3-year-old logic, it doesn't make sense. And it also just very clearly doesn't work. So the challenge, you have clients who try to follow this, their blood sugar comes out high, they freak out. They either respond to this by, typically they just try to cut back on their portions of everything. So now they're like starving themselves. Or they keep eating that way, and then their provider responds by telling them they need to start insulin or medication because it's so-called not safe to go lower carb in pregnancy, lower than 175 grams of carbohydrates in pregnancy. That's the party line. So my approach is different in that I want you to eat more protein. Protein is so helpful in stabilizing your blood sugar levels, and we need much more of it in pregnancy than previously thought. You need to increase your amount of fat, because if you reduce your carbs, you don't want to be low on calories. You still need to get enough energy, right? So you need to increase your fat proportionally, and you indeed still can have carbohydrates. You simply need to eat an amount of carbohydrates in context of your protein and fat intake that doesn't cause your blood sugar to spike too much. And what this looks like in real life is that oftentimes you need a lot less than what the guidelines suggest for carbohydrates. And in its place, you need to be eating more of all the foods that don't spike your blood sugar. So most of your meat and animal foods don't spike your blood sugar. There's a handful of exceptions. Your avocados, as you have here, nuts and seeds, they don't spike your blood sugar. Your non-starchy vegetables, they don't spike your blood sugar. You have a wide array of foods that you can eat more of that actually increases the amount of micronutrients you end up consuming. You actually end up having a better quality diet overall, because you've simply reduced the low quality carbohydrates. I mean, like, we're at a place where the average American consumes 58% of their calories from ultra processed foods. 58%. So any step you can take in the direction of reducing the ultra processed foods and then replacing it with something more nutrient dense is always a step in the right direction. It also just so happens to help your blood sugar levels stay at a healthy range.
Yeah, that makes sense to me. And I don't eat a lot of carbs right now, because if I do, I balloon out. And that's probably a result of years of eating way too many carbs. Like I said, when I was younger as a mom, I was eating a lot of carbs. They were healthy things like sourdough bread and brown rice and things like that. And I ate them with a fair amount of fat, which is probably why my blood sugar didn't spike, but it did not help my children in utero, and it certainly didn't help my own body. So I just want to say that I do notice that if I eat a piece of good sourdough bread, I put on as much butter as there is bread, and that always tempers the blood sugar. Fat and protein, as you're saying, does help to steady the insulin, the blood sugar, and lessen the need for insulin. And that is really important. And that's not something that anybody is hearing, whether they're a woman who is pregnant and concerned about gestational diabetes, or the average person on the street whose doctor is saying, you're pre-diabetic or you are diabetic. And they're giving the same dietary recommendations that you've just explained, and they do not work. Right? They absolutely do not work. I had this other slide up here, and I didn't mean to bring it up at that moment, but just, I think that things like consuming whole salt and bone broth and quality olive oil, things like that, are also important for the developing child, as well as to maintain and build our health. Beyond that, let's say that you have a woman and her doctor is saying you have gestational diabetes. You're going to have to, follow this diet, and you might have to go on insulin. What would be the first steps that you would suggest for that woman to try to halt? And this is a thing that the doctors aren't saying you can change it, but you are saying, we can change this course, we can stop it. So what would you do right off the bat or suggest?
So right off the bat, I mean, the first thing you have to do is to start consistently checking your blood sugar to see where you're at if you're not already.
Yeah.
The that is really the only way to know where you need to be making changes. And I think I am personally a proponent of everybody who's pregnant, whether diabetic or not, to check your blood sugar at least for a period of time or a handful of times over the course of pregnancy to make sure your blood sugar is in a healthy range. It is the proactive choice, really. And if you find your blood sugars coming out high after meals, then you can look back at those meals and try to identify, okay, what was the component of that meal that's spiking my blood sugar? Maybe, as you're talking about sourdough bread, right? There's so many differences, individual differences in how well our body processes carbohydrates. So somebody may do just fine with a breakfast that has, eggs and a piece of sourdough toast with butter, and their blood sugar is fine. And the next person, they can't handle that amount of sourdough. So maybe you try a half piece of sourdough the next day. Maybe your body can't do any of that. Okay, then we're going to boost up the protein here, keep the breakfast really low carb, and see how you do with that until we get to a point where you can keep your blood sugar at a healthy range. So first and foremost, get tests so you can see where you're at and start making little adjustments. Vast majority of clients I've worked with really need to bump up their protein intake, especially in the morning. That is when you tend to be the most insulin resistant. And, protein needs are going to vary based on body size. But for most individuals who are pregnant, we're looking at a bare minimum 25 grams of protein at breakfast, maybe 30 grams or maybe more. Say you're 5'11" or something. You might have higher protein needs than somebody who's 5'1".
Yeah.
So more protein at breakfast really does help set the stage for more stable blood sugar levels, less hypoglycemia. Like you, I'm also very prone to reactive hypoglycemia, and I have to really keep that in check and really go ham on the protein to prevent that from happening.
Go ham. That's interesting.
Yeah, good pun, right?
Yeah.
That really does help. So we have tons of research studies where they give people with and without any diabetes issue a high protein breakfast compared to when they give them a high carb breakfast. And you look at what happens with their blood sugar and insulin levels, their cortisol levels, their hunger and fullness cues, how much they eat at later meals, their cravings, across the board, everything is better when you get a protein-rich breakfast. So that's always one of the number one things that I focus on with clients. And then I like to also approach it from focusing on what we're eating more of rather than what we're cutting back on. Certainly you could take it either way, but people kind of err on the side of I'm just not going to eat the bad things, but it's important to think about what are you going to eat more of? And until you hit that optimal level of protein intake, you're probably going to continue to be tempted by the processed foods, right? So
yeah, I definitely noticed that immediately once I started increasing my protein and fat intake years ago, that I no longer craved the ice cream and the bread and all of those things that I previously had craved.
It's dramatic.
It is.
Yeah.
It is. And so when I do talk with people, and I'm sure that you experience and witness this, when you're talking to people who are kind of hooked on carbs about cutting their carbs and increasing protein, for instance, a lot of times people feel like I did it once wait, I can't, how am I going to do that? I want my ice cream, my donuts, my whatever, XYZ. For me, it wasn't donuts, by the way, but it's hard for people to fathom that they can actually lose the craving for those foods that are making them sick when they replace those foods with protein and fat. And I want to ask, when we're talking about protein, you're not talking about combining beans and rice. You're talking about animal source and not lean necessarily.
Correct.
Okay.
Correct.
I wanted to elaborate on that.
Yeah. plant proteins can certainly still be consumed, but the challenge with the plant proteins, there's many challenges with the plant proteins, but some of the challenges are that in plant foods, the protein is really in small concentrations and it's diluted by a high amount of carbohydrates. So people will talk about, okay, well, I'm just going to have these beans. Okay, a cup of cooked beans may give you about 15 grams of protein in the context of 40 grams of carbohydrates. Now, beans are still great. I'm actually a fan of people including legumes. They're beneficial for other reasons, but to think of them as an optimal protein source, it's fine as an adjunct to your diet, but as your sole source, not so great. Or what about quinoa, right? A cup of cooked quinoa gives you only 8 grams of protein, and again, with 40 something grams of carbohydrates. Whereas if you just have, a 3-ounce piece of chicken or a 4-ounce piece of chicken, you're getting, 20 to 28 grams of protein and 0 carbohydrates. It's also fewer calories, by the way. So that sometimes can be beneficial for other reasons. But you also get a different amino acid balance. You can digest animal proteins better. So it is optimal to still have some animal proteins in the diet. And I can tell you my biggest challenges in helping clients with glycemic control have been in those who are vegetarian or vegan. It makes it very, very challenging. So definitely the animal protein should be a really central part of the dietary plan. There is a reason that there is not a vegetarian plan in Real Food for Gestational Diabetes. And my other 2 books have over time evolved to include increasing amount of information on considerations for such eating plans. So there's like a little section in Real Food for Pregnancy on some micronutrients of concern. And then in Real Food for Fertility, I have an entire chapter. So not just the micronutrients, the amino acids, the macronutrient balance, the overall caloric intake, the issues with fatty acid ratios. I mean, there's a ton of considerations on that front. And the other thing for animal foods, as you alluded to, you don't want to be taking the fat out of things because there's a reason the fat is in there. There's a reason, eggs have a yolk and milk has a cream top and your steak has a fatty layer and your chicken has skin. And those do have other important nutrients in there on top of just, the protein that's in there. So we have the fat soluble vitamins. Sometimes these fatty cuts have more collagen in them. So if you think about like the chicken skin, super rich in collagen, your requirements for the amino acids within collagen, including glycine, go way, way up during pregnancy because your collagen turnover and collagen demands are way higher as well. So I do always warn people about the obsessive fear of fat. We got to get over that. Because if you try to do this diet, just like high protein, low carb, but you're still restricting fat, you are going to run into major issues. You really do require that fat for that blood sugar stability and all those other micronutrients and amino acids that are in those fattier parts.
Including and especially for the building of another human being inside of your body that requires all of these things. When I have talks, I often give nutrition talks about, nutrition for healthy families and so on and so forth, or get into discussions with vegans when I'm at a conference. And I like to say that babies are not vegan, that if in utero the mom is not eating her chicken and her burger or steak or getting all of these macronutrients, the baby still requires it, and the child will pull what it can from the mother's own body, which is highly problematic, of course, especially with repeat pregnancies. And yet we're not hearing enough about that. I love to hear this from you because I remember when I was first pregnant with my first child, with Aaron, I remember thinking how amazing it was that my body could produce a child. I didn't understand nutrition at that time. And I didn't even understand very much about needing to take in major nutrients.
Right.
I kind of went sailing along. I was eating a fair diet, better than most. I wasn't eating highly processed foods. But then later, as I learned more and became exposed to the research of Dr. Price and the Weston A. Price Foundation, I realized It takes a lot to build a healthy baby.
It does.
We should not ever minimize that or think, well, oh, we'll be okay. I can get by on beans and rice. I can get by on quinoa and steamed vegetables and olive oil, when in fact, some of the things in those fats are important even for metabolizing the protein, like vitamin A.
Yeah.
Or building the proper proportions, the symmetry within a child. And you don't get vitamin A from a carrot. So that's one of my pet peeves too. So I love to hear you talking about the need to have all of these foods in the pregnant mother's diet. We just don't hear enough of that. And you probably get some kickback from some of your clients and probably from some of their doctors.
I mean, yeah, I'm out there saying things that are not the standard, because the party line is that a vegetarian or vegan diet is appropriate for all life stages, including pregnancy, lactation, and infancy and childhood. And I very strongly disagree with that. You know, again, like my latest book, Real Food for Fertility, has a whole chapter going through the evidence on this. But just to give you like a small snippet into this world, just taking vitamin B12 as an example, deficiency in vitamin B12 or just low vitamin B12 status during pregnancy predicts low vitamin B12 levels in maternal milk and low vitamin B12 levels in baby. Baby will take everything it possibly can from mom, for sure. Yeah. But after about 4 months or so post-birth, their B12 levels, if maternal levels are not good, because if mom's B12 status is compromised, her milk B12 levels are super low, not enough for the baby. So by 4 months or so, the baby is often burned through their B12 stores. And this is when you start to see the signs of deficiency. And you can literally see it on MRI. Well, first of all, you see the symptoms in real life. The baby maybe who is rolling over is no longer rolling over. They're not making eye contact. They can't stay awake. They get really tired and sleepy on the breast. They're not taking in enough milk. Their muscles start shrinking. They lose control of their muscle and motor movements. And this is a sign that their myelin sheaths that cover their nerves is actually breaking down. You can see on MRI, there's demyelination and there's cerebral shrinkage. Their brain literally shrinks if they don't have enough B12.
Yeah, I've seen pictures of.
There are so many case studies of this in the literature, and it's happening more often now as we have more people going plant-based. But what's really important about this is, yes, you can catch it early, and yes, you can treat it, and by golly, you definitely should. But in 50% of cases, even after they restore B12 levels, these babies have permanent intellectual disability. Their brain development is permanently damaged because there are very specific time points, periods of development where these nutrients are required. You can't go back and make up for it later on. That was the period where this part of the brain was developing and you needed B12 and you didn't get it. And now you have these consequences, right? So B12 is one example, but we have to think about, if you're not getting the B12, what else is in all the foods that have B12? That's where you have your iron, your zinc, your copper, your retinol, your choline, your B6, your folate, your zinc, on and on, iodine, all these nutrients that are also super vital for brain development. So I think it goes far, far deeper than just the B12 issue, but that's one example where we have like extremely strong evidence on the harms. And on top of that, our recommendations for B12 are set too low. We've now found that even when you provide 100% of the RDA for B12 in pregnancy or lactation, it's not enough to maintain maternal B12 status. They've suggested we actually need triple the amount. I would argue it's probably even more. So you have somebody who's well-meaning, they're eating a vegan diet, they're taking a prenatal that has 100% of the RDA. They don't realize that's only 1/3 of the B12 that they actually need, right? So we have a serious, serious problem. Like if we're to trust that the guidelines are all perfect and the RDAs are all perfect, which they are not, and then assume that plant-based is perfectly fine for pregnancy and postpartum. I can't tell you the countless, stories I have from individuals where they really regret having made that decision, not just from the brain development standpoint, but, to allude back to Dr. Price's work, their teeth.
Yeah.
You see dental enamel deficits in over 30% of children these days. 30%. That's insane. And that's a deficiency in minerals and your fat-soluble vitamins,
Yeah.
especially vitamin D. We have super strong data on vitamin D deficiency contributing to dental enamel defects. So, it's in a dire place. So yes, I get a lot of pushback, and honestly, if it's going to save one child, it's worth the pushback. I can handle some angry emails. I got plenty of those.
Yeah. Well, what do you recommend for the daily intake of vitamin B12 then? Do you have a standard recommendation? And I don't mean supplementally, but from food.
So what I find, if I'm to run a nutrient analysis on, a meal plan that looks pretty well balanced in all other ways, I'm often finding that B12 intake from that diet is more in the range of 20 to 30 micrograms per day, whereas the RDA is set at I believe it's 2.4 or 2.6 micrograms per day. And certainly if somebody is taking, supplemental B12, it's a challenging nutrient to absorb. So oftentimes the levels that might be in a prenatal or something are much, much higher. If somebody is fully plant-based, the data suggests that at least 50 micrograms of supplementation would be optimal to try to get their B12 status up. But it also doesn't hurt to bump up that supplementation a little higher, given that absorption can be so limited for that nutrient.
And methylfolbumine, I believe, is the more easily absorbable anyway.
Yeah, methylcobalamin, adenosylcobalamin, hydroxycobalamin would all be preferred forms. Cyanocobalamin is not my favorite. It has cyanide in it, literally. It's not my favorite, but that is the one that's most commonly used in fortified foods. So if somebody is relying on fortified nutritional yeast or fortified plant-based milks, it would be in the cyanocobalamin form, which will improve B12 status, but I don't love the idea of also having some cyanide exposure in there as well, just for fun and games, right?
Well, but even just referring back to the title of your book, Real Food, my license plate says real food.
Oh, that's
I
great.
feel so passionate about, we just need to eat real food. So a woman needs to eat a burger or a roast or what? Where are her best sources for B12 for brain development in utero?
Well, the two richest sources by far are organ meats, especially liver, and bivalve shellfish, especially oysters and clams. So those two by far top the list with extremely high concentrations of B12. B12 is also found across your animal foods, more so in the red and darker meat. It's also in fish and other seafood. Like I said, bivalve shellfish being the highest. You have some in milk and eggs, but the relative concentrations are quite a bit lower in those foods relative to the organ meats and those bivalve shellfish.
And most people don't eat organ meats. I've tried to teach people to try them in different ways and how to cook them, or even just to take desiccated organ meat capsules, something. We recommend pluck seasoning to be used every day on your eggs, on your everything, because then you're getting micro doses of those nutrients. But there are lots of other ways of getting them. But most people, unfortunately, aren't eating organ meats, but I encourage people to give it a try. Now, you also talk in your book, I was happy to see this too, about consuming meat from naturally raised, pastured animals, not just meat, but animal foods in general, not from conventional factory farms. That was impressive to me. I was glad to read that. And this was, of course, before I knew that you were influenced. I was beginning to pick up on the idea that you were influenced by the work of Dr. Price. But why is that important?
I mean, the big consideration on there is, what are the animals eating and what have they been exposed to? Just how we don't feel so well and our metabolism gets a little messed up when we eat, processed food diet or a diet that isn't matched well to our physiology. The same happens for animals too. So well, I do want to level set that if somebody does not have access to high quality animal foods or can't afford it, I am of the opinion that any animal food is better than none at all. But if you have access to and can afford it, we do see a better nutritional profile in these foods. You see slightly higher levels of certain micronutrients. We see a better fatty acid profile. We see lower levels of pesticides, lower levels of antibiotic residues. I mean, for anybody who's ever had animals, like I'm not a farmer, but we have backyard chickens. You can see that chickens that have access to pasture and have room to move around, have room to exercise, they're healthier. Their eggs taste better. They're different. And we do see differences in the nutrition profile of, eggs from pasture raised or organically, fed hens. I mean, ideally, if they're out able to, scratch in the grass and peck and eat bugs and all the things, right? What they eat makes it into their eggs, and same with cows. What they eat makes it into their milk and into their meat. So when it's accessible to you, that really is my preference. And, one way to make that happen is to connect with a local farm and do like a cow share. You have to invest in a deep freezer, but it really does pay for itself over time when you have, first of all, you have all the cuts of the meat. So it forces you to eat the high collagen bits. You can ask for the organ meats. You can ask for the bones. You get everything there. So you're not in the habit of just picking up the, skinless chicken breast at the grocery store because it's an easy, fast protein option. Like it gets you in the habit of making bone broth, of making stews, of making use of all the parts. And it's more economical too.
It definitely is. Definitely is. And I've done that for years, but I did not grow up that way. So I had to, I think most of us did not, but we have to learn to make bone broth, appreciate bone broth. My dog is really trying to get out, and I'm going to walk over here because the door blew closed. Anyway, the importance of those foods cannot be overstated. And so here you go, Bruno, stay outside. We had a little bit of a storm blow through while we were talking and everything closed. Anyway, all right, we are almost out of time, and I do want to ask you about one other thing, which we kind of glazed over, and that is about testing for blood sugar. I've done this with a glucometer. I don't think most people realize how easy it is both to acquire one, a meter, or to check your blood sugar levels. But you mentioned how important it was, and I'm with you on that. I do it on and off. So can you talk just for a minute about how to test your blood sugar?
Sure. So, I mean, there's many different methods. The one you're referring to is what you do at home, usually with like a home glucometer. So you just go to the pharmacy, pick up a glucometer. Be aware that there's some that are, have different levels of accuracy depending on the technology and like what they're using in the test strips. So I can recommend, no affiliation, but Freestyle, Freedom Light is a good one. Contour Next is a really good one. These tend to test a little more accurate than some of the other brands, just throwing that out there. But at the simplest, you get this blood sugar kit. It has a little, finger stick. You poke your finger, you get a little drop of blood. You put it on the test strip, which is inserted into the meter, and it gives you a reading for where your blood sugar is at. That is certainly the simplest, least expensive option to check your blood sugar. There is, of course, more advanced technology out now, like continuous glucose monitors, which are amazing if you have it available to you. I've done several write-ups on my website on using a CGM and what I've observed, having like an oatmeal breakfast, for example, versus one of my usual breakfasts. It's fascinating. What's cool about those is you can see in real time, like how quickly, how high your blood sugar is spiking and how it comes back down. Whereas with a finger stick, you're getting a single time point of checking your blood sugar. So it's still helpful, but you don't get like the full picture that you would get with a 24-hour graph of 200 plus readings a day, right? But yeah, those are definitely the least expensive option, is to just do a home glucometer. With gestational diabetes, you're typically checking your blood sugar first thing in the morning, which is called your fasting blood sugar, before you've had anything to eat or drink other than water. You want your hands to be clean because that can impact the validity of your test or the accuracy. And then typically you're checking after each meal as well. Usually 1 hour, 2 hours. There's different methods of doing it. I typically recommend checking out 1 hour these days. I find that is more likely to catch the spike in the blood sugar, which is really what you're trying to get. But if you were to test with a CGM, for example, you may notice like some meals might spike you at 45 minutes. Some meals might spike you at 90 minutes. The higher carb, lower fat, lower protein, you get an earlier and higher spike. As you add fat and protein, you tend to get a lower but delayed spike. So, and maybe less so a spike, but it depends on the amount of carbohydrate that's consumed at that time. So say you have sourdough bread, no butter, nothing with it by itself. That'll spike you higher and quicker. If you were to add fat, you may have a delayed rise in your blood sugar, but the fat will kind of keep you a little more steady, which can be a good and a bad thing, right? If you're having like a whole lot of carbohydrates with a lot of fat, your blood sugar won't spike super high, but it may stay elevated for longer because that fat kind of stabilizes that blood sugar level. Protein tends not to raise your blood sugar. It tends to just keep it even keeled, and really, like fat, protects against hypoglycemia pretty substantially. So it can be fascinating to check your blood sugar and just see like where you at. It's a good experiment.
Well, where should our fasting blood sugar levels fall? I know that it's going to be hard and fast every time.
There's different recommendations based on whether you're pregnant or not. So in pregnancy, the goal recommendations are lower than outside of pregnancy. So if you're pregnant, less than 90 milligrams per deciliter for fasting. Outside of pregnancy, less than 90 is fantastic, but the standard is to try to keep it below 100 milligrams per deciliter. I think aiming for 90 is a great goal, but if you're at like 95 or 97 or something, that's still considered okay. And then after meals, again, there's different goals in pregnancy or outside of pregnancy. And there's different opinions based on, what are the reference ranges, but what's optimal, right? So in pregnancy, they're typically trying to keep your post-meal blood sugar below 120. It depends on which guidelines you're using. Some guidelines are more lenient, but in an ideal world, for minimizing the risks as much as possible to baby, less than 120. Outside of pregnancy, standard of care is just less than 140 after meals. I do like to see it closer to 120 in an ideal world, and hopefully coming down pretty close to 100 after 2 hours. But again, there's wide debate over, what's normal, what's optimal. So if you err on the higher side, just kind of watch it a little more, play around with your macronutrient ratios.
I'm eager to start watching again. I had a couple of months ago, I had started. I was well within range, happily, but we're going to put in the show notes the 2 recommended glucometers that you mentioned. So I do want to make sure that I get those right. You said one was the
Freestyle Freedom Light.
Okay.
The other one is called Contour Next.
Contour Next. Okay. So we'll make sure we have links for those, because I think it is very important. And again, not just for pregnancy, but across the board. And Lily, I want to come back and talk with you again, if you're willing, at a later date when I have finished the book about the, I'm going to show the titles now because I'm not going to remember. Oh, your course, your online course. I wanted to bring that up.
Oh, yes. Yes. So this is a, online program. I've been running it now for over 9 years, that walks you through much more of like the practical application of the information I cover in the Real Food for Gestational Diabetes book. So there's 21 days of meal plans offered at 3 different carb levels. There's advanced training on topics that I don't really dive into in much detail in the book. So managing fasting blood sugar in pregnancy, for example, is a pretty major challenge for a lot of women. They may control their post-meal blood sugar just fine, but the fasting blood sugar is really difficult. So that's a training I literally don't have anywhere else. Just tons of resources. There's also a private Facebook group that goes with it. So I'm in there every week providing feedback to member questions that have come in during the week. So a lot of people will use it in combination with whatever they're doing with their clinician. They're kind of getting a second opinion or bouncing ideas off of me and also other course members. So yeah, it's a really lovely group we have.
That sounds really exciting. I wish we would have had something like that available when I was having babies. But Erin is putting a link to that in our show notes as well. And then we've got the Real Food for Pregnancy, which is the book I was beginning to mention. And also, I forgot. I don't have the other one, the Fertility. Real Food for Fertility, which is something that I'd love especially to delve into at a later point in time. So many people that we come across are struggling with that. And I can't think that I've ever met someone who didn't turn back to real food from a processed food diet and incorporate plenty of animal foods who didn't successfully become pregnant.
Yeah.
I'm sure that's happened, but
I mean, a lot of the same general principles that we've talked about today for gestational diabetes apply to general pregnancy nutrition, apply to fertility nutrition. The difference between the resources, even though there's sort of a general theme that is consistent on the real food and sufficient protein and blood sugar management and all that, is that the research is all different and there's different topics that are covered that aren't in the other resources. So the gestational diabetes one is very focused on the blood sugar aspect. The pregnancy one is very focused on the myth busting around pregnancy. So the foods that you're told to avoid, the warnings that you have about consuming liver because of supposed excess vitamin A. There's information on a really detailed chapter on postpartum recovery that isn't in the other books. We talk about all the different lab test options. So that one's a lot of myth busting and providing you the evidence for why the guidelines on certain things don't necessarily make sense. And the fertility book is huge. So as you notice, you're reading Real Food for Pregnancy. It's bigger than the gestational diabetes book because the goal with the GD book was to really simplify what to do about this and give you the information in a super concise way. Mm-hmm. The Real Food for Pregnancy book, or Real Food for Fertility rather, is like, it's 30% longer than Real Food for Pregnancy already. Okay, it's like a 500-page book. And that covers a wide array of topics that just don't apply in pregnancy. We have sperm quality, a whole chapter on that, a whole chapter on egg quality. We cover PCOS, hypothalamic amenorrhea, recurrent miscarriage, endometriosis, all the various fertility labs. Like I mentioned, the chapter on vegetarian diets, sort of like a, planning checklist for how to organize, like what to do and what to plan for it at what times, pregnancy spacing. There's just a lot of information in there that isn't necessarily in the other resources. So they are complementary resources. Pick the one most appropriate to you. But yeah, I'm glad that we have them out now.
Yeah. Well, thank you. Thank you so much for writing them, for researching and writing, because this is such an important topic and so timely, with so many women today struggling with all of these issues. And I believe it's because we've abandoned our traditional food ways and exposed ourselves to toxins and fake food that are devoid of nutrients. And so we need to go back. We need to go back to real food. Well, Lily, it has been absolutely delightful, and our time has just flown by. But we're going to close right now. If you have one final word you'd like to say to our viewers, go ahead. And if not, we'll just close.
Sure. Well, if anybody wants to find my work or where my books are, or find me on social media, you can find me at LilyNicholsRDN.com. I have a, repository of hundreds of blog posts. There's no paywall on my website. It's all free. You can download the first chapter of Real Food for Pregnancy over there. We also have the first chapter for free of Real Food for Fertility over at realfoodforfertility.com. So click around on my website. I have a lot of professional training for health professionals as well. And then social media wise, if you want to connect, I'm most active these days on Instagram, although I'm on the other platforms as well. And my handle's the same as my site. It's Lily Nichols, RDN.
Good, thank you. And that's actually already up in our notes, and we're going to make sure that we share that widely. Thank you so very much. And folks, definitely check out Lily's website, pick up a copy of one or all of her books. I'm on my second. I'm really looking forward, Lily, to reading more and hopefully to having another conversation with you on down the line. I just appreciate your work so very much.
Thank you. I really appreciate your time.
Yeah, thank you. We'll see you all next week at 3 o'clock. Bye-bye.